Good afternoon, Vallejo. You are watching VCAT, your hometown television station. This is Community Forum, and I am your host, Maria Bitagon. You can see our show on Channel 27 at Comcast and on Channel 99 at AT&T Uverse. We are recorded on Tuesdays and Sundays at 6:30 p.m. I want to welcome my guest today. I have met him at Reverend Bernardus' event, and I'm so happy that today I have Mr. Ted Selby. And so that I don't have to introduce him to you, I want self-introduction. So I'm going to ask him to tell us a little bit about himself and his role in Solano County.
Well, before I do that, Maria, I want to thank you for inviting me to be with you this afternoon and tell you how honored I am and how much I appreciate you taking the time to meet with me on these important matters. So my name, as you said, is Ted Selby. I work for Solano County. I am the Medical Services Administrator for the county. What that means is I actually wear several different hats. One of my jobs is the Emergency Medical Services Agency Director. Oh. I'm also the Executive Director of the Public Health Clinics in the county, which we have clinics in Fairfield, Vacaville, and of course right here in Vallejo.
Right.
And I'm the overseer of the Medical and Health Emergency Preparedness and Response Programs. Mm-hmm. And lastly, I also oversee the Family Health Services outreach and mobile medical and dental clinics for the county.
Have you got any time for yourself? I just look at it and I'm just looking, and following, what you just told me. So because the people would like to know what those things are, what it entails, can you tell us a little bit more about the programs you mentioned?
Absolutely, I'd be pleased to. The Emergency Medical Services Program is something that all counties in the state of California have the ability to create. We all have an Emergency Medical Services Program. Mm-hmm. Not all of the counties, however, have an Emergency Medical Services Agency. Oh. Here in Solano County, we have our own agency. The Solano Emergency Medical Services Cooperative is the board that oversees the agency. I oversee the staff that work at the agency. So we're responsible for the emergency medical care for all of the citizens and residents in our county.
Oh my God.
So what that means is that you may be aware of the trauma centers in our county. Yes. We're responsible for the trauma program. There's a program that is created for a very specific type of heart attack, the most common type that takes people's lives, and that's ST elevation myocardial infarction. But what we like to refer to it as is STEMI. So we call it STEMI. It's an acronym for that lengthy terminology. Yes. And so for that program, we're also responsible for the oversight. And then for ambulance operations in the county. Now, Vallejo is home to Medic Ambulance.
Yes.
Medic is the exclusive operating area provider for ambulances in all of the county except the city of Vacaville.
Wow.
In the city of Vacaville, their fire department provides 911 service, but all of the other ambulance service that is considered advanced life support is still provided by Medic Ambulance even in Vacaville. Yeah. So they provide service to the entire county, and they're located right here in Vallejo. They are a fabulous ambulance provider, and we have among the best response times in the whole state of California. The other thing that the Emergency Medical Services, or EMS agency, is responsible for is accreditation and licensure of paramedics and emergency medical technicians.
Okay.
So it's quite a lot to provide oversight to these types of programs. Now, that's only one of the hats I mentioned.
Yes.
I also am the executive director of the Family Health Services clinics in our county. I mentioned previously that we have 3 cities that we reside in, Vallejo, of course, Fairfield, and Vacaville. And we provide adult and pediatric medical care as well as dental care in all of these clinics. So I provide oversight to the clinic operations for those brick and mortar clinics. Then we have the Emergency Preparedness and Response Program, which exists to assist the county, other departments in the county, and hospitals and medical partners with developing plans to respond to the medical and health aspects that occur during disasters, catastrophic events, and emergencies. So we work with all of the hospitals in the county and with the skilled nursing facilities and the clinics to help them plan for and be prepared for these emergencies. And the last program that I'll mention that falls under the auspices of my position is the outreach programs for the Medical Services Division, which includes the medical mobile clinic and the dental mobile clinic, which we take to different locations throughout the county, as well as the various health fairs and special events that we're a part of.
My God. Do you have time to breathe in the middle of the day? No, I was just like, because, and it's various services, various people being served, including the children.
Yes.
And, and even dental.
Right.
My God. So that's pretty, so I don't need to talk to anybody, I'll just call you.
Getting a hold of me can be difficult at times.
That can be difficult, but I says, even if it's the most difficult thing to do, because you get to talk to the person who does everything. I was wondering, where can Vallejo residents expect to be transported if they're involved in an accident or if they have a medical emergency? Which places or what is the location?
Yeah, so that's kind of an interesting question because there are several responses to that question.
Oh, okay.
So if an individual is in, let's say, a traffic accident on Interstate 80 here in Vallejo,
yes,
and they have minor injuries but require ambulance transport, they will be taken to one of the local hospital emergency departments, either Kaiser Foundation Hospital in Vallejo on Sereno, or Sutter Solano Medical Center up on Tuolumne, not too far. They're kind of close to one another,
yes,
but they can be expected to be transported to one of those locations. If, however, the injuries are more severe, if they experience traumatic injuries, they'll be transported to a trauma center.
okay,
And there are various levels of trauma centers. And in our county, we have 2 trauma centers that are designated. We have a level 3 trauma center in Fairfield at North Bay Hospital. So North Bay is a level 3 trauma center. They can handle most traumatic injuries, and we would transport there if it were a traumatic injury. Unless it was so severe that it involved a head injury or a spinal cord injury, then they would need to go to the higher level of care, which would be a level 2 trauma center. We do have a level 2 trauma center in county in Vacaville, at Kaiser in Vacaville. They're a level 2 trauma center. But that could be a little bit distant for a transport from Vallejo. So if it were that severe of an injury, they would likely go out of county to John Muir Medical Center.
John Muir.
So that's kind of where Vallejo residents could expect for a trauma. Now, remember, I told you the acronym STEMI.
Yes.
Yes, STEMI being a very bad heart attack.
Yes.
for somebody who's experiencing that, whether they're at home or in the car, if an ambulance transports them, they will more than likely go to the Vallejo Kaiser facility, because right here in our own city of Vallejo, we have a STEMI center.
Oh,
this is something that they specialize in removing those clots from the heart very quickly. And they go through a process and to be designated, and they have gone through that process, and they are a STEMI center.
STEMI.
If they have multiple patients there, because one of the problems we're experiencing is we have lost a STEMI center on the other side of the Carquinez Bridge.
Okay.
In San Pablo, Doctors Hospital had a STEMI center. So the cities of Crockett and Richmond and Port Costa used to go there. Well, now they can't go there anymore. So oftentimes they'll come to Vallejo.
Oh.
And they'll use Kaiser, which they can only do 2 at a time.
Yes.
So if both of those tables are being used, a resident could be transported to Fairfield to North Bay Medical Center, which is also a STEMI center. So for those types of medical emergencies, that's where they would be transported.
Boy, I didn't know it can be that complicated. I thought it could happen in any hospital could take care. And so, because I recall one time going to Kaiser, and for majority of the time, for things which are a lot more complicated, we go to Vacaville.
Yes.
That's what, and at one time, because one of our people had diverticulitis, and he has to go all the way to Folsom.
Oh my goodness.
Yes. So I said, but I think that most of the people also talk mostly about Vacaville at Kaiser.
And isn't it interesting the evolution we've seen with Kaiser here in Solano County?
Yes, yes.
Vallejo used to be the primary and only center here in the county.
Right. That is right.
And then they built the Fairfield clinics back in, I believe, the 80s. And then the Vacaville clinics back in the 90s. And then the hospital. And now we've got full care throughout the county. So
which is great.
It's wonderful for our residents and citizens here.
Yes. So we have talked a lot about emergency medical services. Let's talk about the non-emergency medical care and what services does your Vallejo clinic offer? We would like to, because I'm from Vallejo, I want to know where to go.
Right.
Okay.
So thank you for asking that.
Yes.
We do. We have fantastic doctors and nurse practitioners and physician assistants that provide medical care right at 365 Tuolumne Street here in Vallejo at our Family Health Services Clinic.
Okay.
I don't know if you realize, but our clinics partner with Touro University, which is a medical school located right here in Vallejo on Mare Island. And so we have an official partnership with them, and they rotate medical students through our clinics. We have their faculty on staff in our clinics. So these are the physicians that are also professors at medical schools are working part-time in our clinics because they have to spend their time on campus, of course, teaching the physicians that are studying to be physicians.
Yes.
So it's important that they do that. But we have primary care, which for both adults and pediatric patients in the Vallejo Clinic. We also have dental care, but that's offered only for pediatrics at this time. We only have one dental chair in Vallejo at this time, and there's a need for more.
Okay.
We have a wonderful women's health provider. Her name is Tina Mason, and she's very well known. She's a professor at Touro.
Yes.
And she is doing a fantastic job working with our are women that need specialty care for women's health. And then we have a diabetologist, which there's not very many diabetologists in the country at this time. It's an upcoming field, and we happen to have Dr. Jay Shubrook, who is very well known, who is a very well-known diabetologist. He again is through Turo because he's on staff with them, but he practices with us several days a week and sees our patients in all of our clinics, and he actually comes to each city, so he's got a presence in the Vallejo clinic. We're very, very lucky to have that partnership with Turo.
Do you also offer different services at clinics in Fairfield and Vacaville?
We do.
Okay.
So in Fairfield, we offer, now let's see, you see I've been full of acronyms here today, haven't I?
I'm listening very closely so that, you know, from the first time you say something about STEMI and things like that. Okay.
You've got it. You know, Maria, if the TV job doesn't work out for you, maybe you should come and work with me at the county.
Oh, that is so great. I wish I had a health background, but mine is mostly business and
and television. You do a great job. So OMM, or osteopathic manipulative medicine, is a specialty service that we offer in Fairfield.
Okay.
Again, it's called OMM, and it's really a specialty of osteopathic physicians, and they work on treating kind of the whole body through manipulative medicine, you know, moving the body, and some people would liken it to what chiropractors do, but it's physicians who practice it, and that's in Fairfield. And then in Vacaville, we have a rheumatologist who works part-time in the clinic. And a rheumatologist, for any of the members who don't know what that is, I know I didn't know until I got into this field, treats rheumatism, arthritis, and other disorders of the joints and muscles and ligaments. And so
very timely for this interview, because I'm going to be 80 on July 22, and I need those services.
Well, nobody would ever believe you were going to be 80.
Thank you so much.
Absolutely.
I'm very happy 80-year-old person. I'm going to be very happy when I reach that July 22nd, 80th birthday.
Well, we're going to be very happy to celebrate that with you.
Oh, that's
what
great.
A wonderful,
I'll call you
wonderful.
Reverend Bernardus.
That would be great. I would be honored.
Thank you.
Yes, absolutely. So then we also have women's health services in each of our clinics. Dr. Mason in Vallejo is for those, you know, we might refer there for the very difficult cases, and that's where I brought her up as specialty care. But we do offer women's health in all three sites. So I should mention that.
That's great. Well, let's talk about special events, because earlier you mentioned special. Are there any special events you participate in the Vallejo area? I know that you are so active with the Reverend Bernardus and the homeless, and
Yes.
Reverend Bernardus, you know, just like you mentioned Ted Selby's name, and he's just like mesmerized, okay?
Well, and the feeling is mutual, because I admire Reverend Bernardus greatly. His work with the Christian Help Center and the homeless in this city is just so admirable. He and his wife Eva work so hard, tirelessly, to help those who truly need help that everybody else ignores. So every December, we do a special event, and this is where I met you, at the Homeless Memorial event at the Christian Help Center. And we have been doing that for the last several years, and I am always honored to be invited to share in that evening with not only Reverend Bernardus and his wife and all of the other dignitaries and professionals that are there, but with those people who really need the help. We provide dinner to the homeless,
Yes.
and it is just a really wonderful event. And I plan to be there again in December.
Okay. We'll see
But
you there.
before then, we have a few things coming up.
Okay.
There's a South Vallejo Resource Fair that happens monthly. And for the next 3 months, we're going to plan to be there at the Emmanuel Temple Apostolic Church,
Yes.
which is located at 906th Street in South Vallejo. And we will have our mobile medical clinic, a mobile dental clinic there. So anyone who needs some help, who has trouble with transportation to the
go to the
Tuolumne
county,
Street Clinic, they should come and check in with us. The dates that will be there are March 27th, which is the fourth Tuesday, I believe, of the month, and then April 24th and May 22nd. So it's the fourth Tuesday, and we'll be there for the next 3 events.
Yes.
Then in June,
Wow.
June 28th to July 1st,
Okay.
guess what's happening?
Tell me.
The Solano County Fair. We have been at the Solano County Fair the last 3 years. We have orchestrated and facilitated a health fair for the visitors of the fair. And we're going to do that again. It's been very successful and very well received. We partner with the hospitals and the other clinics and other organizations who are interested in being there and helping to improve the health and wellness of the citizens and residents of the county and the visitors. Yeah.
Well, are there plans to expand or add new services in the Vallejo Clinic area?
Well, I'm so glad that you asked that.
Of course.
Yeah.
It concerns.
Yes. Well,
Vallejo.
so we were talking about the desperate need for dental care here in the city of Vallejo.
Great.
And one of the things that we're trying to do is we're trying to expand those services, and we're doing a study to see if we could launch a larger dental clinic within our Tuolumne Street location, so that we could reach not only the pediatric population, but also the adults who so desperately need dental treatment and care. So that's something we're looking at. We will be adding prenatal and postnatal care. Right now, when a lady gets pregnant, we have to refer her to another clinic for her prenatal care.
Okay.
We will be adding that to our scope, and we will be providing that. Dr. Mason is a champion of this and really wants us to bring it to the clinics. So we're planning to do that. And then we're looking at offering alternative medicine, which would include acupuncture. And that's something that,
Just like a therapy of some sort,
Yes, that's
is
right.
great.
And massage therapy. So there are definitely, and there are benefits to these alternative medicines.
Okay.
And lastly, we'll be looking at bringing psychiatry into our clinics. Right now we have to refer them out, even though it's within the county still. It's another division within health and social services. So we're looking to bring psychiatry back into
That's
our
important.
clinics. Absolutely.
I just look at the shootout there in Florida
Yes.
and psychiatry. So,
Really ties together, doesn't it?
that it does.
Yes.
So is there a place we can get more information about Solano County's Medical Services Division? And because we're coming very close to the end of our interview, could you please tell us that information? And after you have given me the answer to that question, could you please talk to our constituent and tell them how you could be reached and how, all the things that you want to offer to them, and that we will be able to, that they will be able to get this information also, and that you will be right back here. Okay?
Well, thank you. Absolutely. So the way that people can receive more information about Solano County's Medical Services Division is on the internet, of course,
Yes.
at www.solanocounty.com. Now, if you go to that site, you'll need to cursor over departments and then select EMS, which stands for Emergency Medical Services. And there you will find all of the information about the EMS agency, including contact information for me, contact information for all of my staff members, and what's going on. We didn't get into a lot of the specifics about everything that we do, but we have a lot of information on the web that everyone can look to and learn a lot more about that agency. The other website to go to, because as I said, I wear multiple hats,
Yes.
is www.fhs.care. Not .com, .care.
Okay.
C-A-R-E.
Yes.
And when you go to that site, it will talk about the Family Health Services clinics, where we're located, our hours of operation, the services that we offer, and how to reach us, how to schedule appointments. So there's a lot of information on the internet, of course. And then one of the phone numbers that can be called for information for EMS is 707-784-8155. And that will get our callers through to the EMS agency, and they know how to reach me, and they can reach pretty much anybody else in the county, or help the caller find their way where they need to go. But between using the internet and the websites and these phone numbers that I've mentioned, people will be able to find their way around, most certainly.
So thank you very much for coming today. And if you want to come back and give us more information, and if you have additional information, I'll be so happy to accommodate you anytime.
Oh, that's so
Thank you
kind
so
of
much.
you.